biara eye enhyirambre ne akwanya a onyankopon edema ne ma ene menu ni nyinara ye da so yete nkwamu de ne na ne ye ka kira de se adumra ye da wase bebre e won ye pa wo dom ne wo ban bone odo a wo de do ye nso ene nso WTV consulting room bunia Rose Aduful yasan ehie mo ha na busumi de se wo pink no bebia na wo so tumi ase se eye ade a 𝗟𝗜𝗩𝗘 very serious say e wo say obi biara say nyankopon boy yen se ne seso a wadom ye with some beautiful structures e wo ye nipadua so no e wo say etumi ehwe hu ye na enen so eye emre foforo kra ye ba besua noma menim say wate ni bebre menim say wahwe ni bebre na emom enka se mete enra de nti ene de mintie bomode na fra wonu na fra onyonko na ye nyinara ye nsua ade embomo na eba ne say dia na onim say de biara ye de enkrofo mu wo nimdie ankasa papa na ye de omo etwetwe enkomo no so that would have the opportunity to share knowledge, share experience. Now, when him say about experience sharing, so there we ya the same obiara, nyankopon ensure wate, and then so na yabadia, na WTV consulting room, memni de bia no 9 fa ekopim no nsia, yeshie mo ewo hase, se ne be ya betimi atwetwe nkomo na nia e bia opese wodo emu so kore na nasa opese wankasa experience a opese o share no wenya ho kwan ede we amanfo nyinara a ehwe ye a ebi nso etie ye no edisa enkomo no eno nti erinche ebesa aba back ewe emra me introduce ye guest wonderful guest a ye wo ha say ya ene ye ne omo etwetwe nkomo na ba ne sade a nafa ope nafa wo huma a obetimi atrotro normal telephone lines no enche ye shas ye nara so a ye be senior beya ubetumi ebisa wonsem. I said all the social media platforms Ninyinara are very active. You can send your questions and then as well as your contributions. Medamasi bebre se munya akwenya we ede ema meno mieno na yitumi esiade enche mesan abapak nyame ensha bebre.
Therefore, adia chembio ye call ye na so ye koda ye rade adomunti ye nyina ya sorry emofra ko musuku edwumayfo so ko omunyuma so se wo son da yo se wan son da yo ye ka kire sorry na shere sorry na shere dwumadie ya no pabosu dwumadie bi a ye de bre yen se de be ya ye betimi enyini ewo hunhu na yenyi wo hunamu ne mpo etimi yenyini ewo adwene mu se de be ya yenyina betimi akyekere oman na ya kyekere asafo na afi kra yetimi akyekere busua
ye behwe nsem a ekoso oman Ghana mu eni wiase afa na nyina
ye befa ensemi efiko wankrata mu ene abefo internet so
anape bia ye nsem a ema enidaso eni insatwaye ebebre ye de onyankopon asem bebre na ya hweso e de aboyebra afa kan ye hu anape bia na ye mfa enije nsem embre
enenti afa kan ye ho
Anita Kwabo
ene Reverend 𝗥cie Vincent Agdomena ewo Wesleyan TV so afa obetimi ahwe won WTV Ghana ewo Facebook so na afa Wesleyan TV Ghana ewo YouTube so sorry na sharing
wake up to a purposeful day.
Jumadie aboafo bi te se
All Insurance, multi-credit savings and loans.
ana Methodist University Ghana ana aso yasen
Meye mi fie Christian fie Mema mi kun aye Christian ni na me mofra aye Christian fo Mema mi fie aye Christian fie. Ban papam eye dwumadi a ekoso ewo WTV so. Kasa afa ekwan a ye tete ye mofra. Ekwan a ye befa so ama ya ware ayefe ne ya ware edimu. Efie entete anase efie siesie ene efie nkomodie mu nso yenya ento nchen. Into me to sa frɛ sehwe WTV na nneɛma pa bebree ɛwɔ WTV so enwumpa enkomodie papa nneɛma pa ɛbɛboa me ne omienu ɛne yɛmfie kɔso ara na hwɛ WTV.
How does the story of old influence decisions and lifestyles of today? How can we tread the path to salvation based on past events? Why is history important, and how can it inspire the future? Another says, a generation which ignores history has no past and no future. Join us in a talk show program.
Tell me the old story.
Right here on Wesleyan Television, as we engage knowledgeable people with facts in history that will influence our present and shape our future.
Make a date with us every Saturday at 7 p.m.
as we delve deep into our history. God bless you.
Tell me the old story. Brought to you by the Heritage Directorate of the Methodist Church, Ghana.
Right. Thank you so much for patiently sitting through to wait for us. And like I mentioned earlier, you know, anytime we come here, I don't do this alone. I do it with you. Thank you so much for your commitment, the love. Hey, Mama, Frederica, Mame, Nyami 𝗟𝗓𝗡𝗃 why Debiara da wutie and then say aba, and you be biara mota efreye, and then himself mbesa ayenesa, ne atwetwe enkomo, especially on more personal experiences to share. No, we are so grateful, Nyami 𝗟𝗓𝗡. And so today we're going to look at breast cancer. Munim say October ye, yes, there were normal baby, but nia edi mu akotrepa breast cancer. Enti baby obedu biara na pink so say enye a whole pink, a shade of pink, a touch of pink, something of pink. Enti ene dia me say me play ma me guess ni ensisi me. But at least one extent, so when see me in some way, would say me yo dia obehu bibi wo mutsi mo man cancer me so would be very but you're looking gorgeous. Ladies, nice meeting you. Good evening. And then it's always a pleasure to have wonderful people like you on our stage and platform. And when see ye niaba ye dikai ame boni dino nyame adomo oye onimdie e woni e friend palliative care ho and into oye palliative nurse specialist e wo the surgical department of 𝗟𝗡𝗡 Teaching Hospital, palliative nurse specialist e wo surgical department of 𝗟𝗡𝗡 Teaching Hospital. Na ye friend no oba Nancy Ishen Nancy Mpocho akwaba ye the radius say and then so wait to me enya emre amayenya odi yen ebetwetwe enkomo nyamisha na apart from Auntie Nancy one mama fefe bi bae we don't even say so you're 16 or say 18 or say 17 or wow she's looking so beautiful. And this is a wonderful woman Nyankopon edom na breast cancer ye ka ho asem you know personal experience to share no money bi wo hwa obi e ka trewa utumi appreciating no better. And so we couldn't have done such a thing without a personal experience from an individual. And this is a woman who has accepted to be a part of their campaign to be a part of the platform. Send your baby to me issuing normal bebre efimo na your friend no Mrs. Felicia Amono. Mama me pacho akwa bebre and also your dasi bebre say we to be enya every amaye WTV crew any obi biare wo ha yesi ye ne esomo bebre nyame ensham why great entina ene de yasha se ne de yasha se but why feel seriously why feel you know anything pink is unique. Am I feeling that girlish thing, you know? Okay, great to have you here once again to say right. Inti and then I am say if he oba Nancy so Nancy say about breast cancer. Only ebefemo what the breast is and sana ya can about what even the cancer is to the breast. Inti you can take us through.
Okay, me that's very oba mpokia sanya account for friend no.
Oh, everything.
Mpokia.
And kaya ye kuya oh, mpokia. Oh, okay, that's nice.
Yes, so something that shows feminism. Say oba ejina homa oba ye. Ti nyini a sebio ye nyina ye boy flat. As enyine koso no akrani drew adolescents na. Then you get to distinguish say where your bar, where your bema. It's an say bibi bejina na bo. Aha, and on your friend enufuno. Though I shall see you na yenufuni a flat. And so a bedroom stage be na homos any a yini a yini a diana paye d and in your mature and wish ya and then send your uncle body no. Well sense ye abba. Into bedroom or not fed when we saw banner, nenufun ayakesi. It comes with other signs, other developmental stages and so, but you will concentrate on the breast.
Exactly.
Inti enufuni ya dear ma or bad dance. And no na se nipa bebre kwa ye show be a boy. It means say we your bar. We there say me say asa oye be makakra. Na ejina ho
oye be makakra.
Na wo ne Francis danka eye niema bebre ni tichu ne se be ma kra nufu nti nyankopon bo se ema oba ho nyefe be me hu na ema ne kondo no
Ema oba ho nyefe
be me hu no so na ma ne kon ado no
nti se ye oyire no ema ni kunu
ado no aha nti enkra so be mu a it serves the child as well. So it serves the husband, it serves the child.
And even you mentioned the woman as well.
The woman.
In teachers say adeko no ye nyina obi anya ne benefits mu.
Yes.
Okunu nya ne de emanya wo mo de na oba na nkasa nso kwa no enya ne de. Awesome.
Yeah.
Yes. Inti na vitamin so person dey be ka ho fatoso.
Inti senya ne ye ka no. Inti for the very, very important, even to the men more than even the women. I say, who here men more. But who here ye na. Inti say enough for ne yaria na asem kese enaba. Enough for yaria so de bebre. Na neno de yebeka breast cancer and wasem. Ye kan kokrama yare bia ne fa kese no enam aboa bi so na deba te se sene antonton beka no enya malaria ana ubenya cholera virus na wenya cholera no nti kokram de enye emwa bebre na deba aha nti ye fa no breast na eye sene wa body no ana wo nipedua na asesa na bosu ena no na me kan say ase iron a thermostat ase won say otu adea etimission no enti nyankopon de ase body nim say nyini endore e multiply edru baby a ebeto ne bo kakra eto ne bo a na kwa bi wu efimu a na afedie body na kwa na ye friend cells no ato aso enyini biem ye de etiri be ye mfato ho yemu bebre start yeti bonye ne enso Ghana ni bia ni ho ni ti hwidu ne na ase
Seriously.
yes efu adu bebi a eno atimetia nature na sanso start bio sana nyankopon aye body ni nya fi ya pempemesi ye na ase enti na wogina wo more kra na at a point it breaks. So it breaks because the dead tissues must go off, then the new ones will start again. But this phenomenon, no, if the body doesn't obey it, if one particular cell chooses not to obey it, no do onyini ani so onyini obe sababa ye abnormal cell. And no ye ka say, oh, as when you tumor, as a mass biaba, as a body na sesa. Na no so sa no, ye wana no so types mienu. Baako a eno no de ye beka say benign, which is enya cancer and spreading. Though eno so abnormal growth, but and spreading. E bitimi butu enufo no, fibroadenoma, a benign tumor, but enya cancer. Inti ye ne ema yenam ye bokase e cancer no. Ni say inti cancer no de eno de timi tra echo body na akwa bebree emma etimi me fa say it is life threatening. Nyame ambemu a etimi etwa wonkwanna no so. Am I right? Etimi twa wonkwanna no so. Nti na ye bo ye nkratwe ana
ye bosa de ru.
Yes, ye bosa de ru. Ama man say nyina te say breast cancer is very curable if detected early. But ye hun and temwa. And then I say be advanced na fe do be palliative case.
Me that's bebre intine mama can breast cancer very curable when detected early. And until normally bebre wo hwa say emra ye ti hono na ode toto ho. So when him say and 19th of October unya enkoye one kasa self breast examination emma woma yen kire won so dia enemy pato clinics ni nyinara baby obekobia some facilities kwa here in their offices. We shouldn't shy away from them. Is opportunity wenya bia na enka next year obeka say oh last year me koye ya nka yehu we entem yen pese bibi sa ebesi enti mayen tumi enye hwehwemu ne entem na mwe bi wo ho a yetumi ede abro sa na oba nansi eka banansi ansa na meko mama so no na wo ka say tumors ni bi wo ho a ebinye cancer. So what is the difference between a tumor is like tumor I beka say a cancer na wo ka be fibro bibi fibroadenoma. Okay, nti so betimi achreche enumu kakra ansana ya call ashani betimi adedi ne akomama to
me da si bebre nti me ka say tumors no ana aba beda ema no enufonum no enye ni nyina na ye taye cancer ne ye cancer ne ye ni a sebio enyinia defa enufo ni nyina na afedi atra enufo no so akọ baby to say yahrawa, which is the lung, liver no yembre bo ebi de kra ti me kom adwenem the brain ebi so call bone nim but benign tumors no they don't spread into no send your way no phone nim a sana be kopem si ebi ana kopem se no so abosu besesa ebaba bedane yare bone ipachena.
Okay, enti eno no ehye say yebetimi aka say obi ewo that kind of benign growth no but eno no de enye cancer. But is it possible say biana a benign growth can advance into a cancer? Especially with the breast.
Yes, obi awenya ya nufomu ya rieda. Could be you could have had just the benign tumor some time past. Later in life they can get the main malignant disease
later in life. Okay, then in the infant so what are some of the contributing factors? And I say if there is a cause, what could be it? What are some of the contributing factors?
Yeah, that's super brave. The causes of cancer.
Because if you offer now come a maso maybe sad you do who yeah and sad or bear mono.
Oh yeah, that's causes of breast cancer dear, honestly we name. But we have something we call the risk factors. Risk factors ye niema bia ewo ye ho ana wo ye a ema wo ho kwan se that say wobetumi anya breast cancer ni bi na ye wono afa mienu afa baako ne se enema untimi nya ho hwee ena afa baako aka no so ye factors wobetumi aye ho bibi mana yiye enti se ye fa enema yentimi nya ho hwee which is the non modifiable factors ana ye be poto na aka eno no the fact say we oba the fact say we oba or a higher chance of getting breast cancer than bema. And she say mema 1 out of 100 can get the breast cancer, but with a female it's a lot. And you find the African race, you find race in the Africa, and I'm fan say blacks, a higher chance of a more aggressive cancer than Caucasian partners, no. Even with the men, no, generally, nanke 1%. But no, the African race could be Black American. Once you are black, no, the chances of a man getting it is 1 to 4%. Yes, out of 100. But a man, a question. Yes. So the fact that gender, no, the fact that you're bano gives you a higher risk than your male counterparts. Yabani age, bibi I want to me ancestral. Though it be say football age, but the body knows the actual age.
I saw you. I saw you.
Inti when your football age asem. Yes, Inti a funny age. You should much less anka post-menopause. Inti anka 50 years ago. That is they have a higher risk. But Professor Bako research and you who say in fact in Ghana the ages between 25 to 50 are higher. Ghanaians are enya yare no. So age bracket no was sure. Actually 50 years going no. It's not just I say year story any difference kakra.
Because these are the people within their reproductive age, and then they are also the people in their productive ages as well.
Yes. So we've had a few of our patients being lesser than 25. Yes. But bulk of it near 30, 40s, maximum 50. One bina a kokoye in their 60s. Tinacha say indeed we are having the lower ages than our Western partners. Yes, please. In the age, no. No. Any far race, na mabo race, na so we can't change our race. Sabio, also sounds skin no cry. Once you're a black, you're always a black. Onu me draw cry, you are still a black. Into the blacks, we have a more aggressive tumor than a profono. You should show me because why it is so, because a African no and African people per se, even the Black Americans, they've realized that they get the more aggressive type of the breast cancer. Breast cancer, but the more aggressive type, and more aggressive type, and no ekunya in tem. Abrofona survive more because yes, it's not so aggressive to say it. It's way no to shame. Another one say early menstruation. Inti efano your reproductive health hona your menstruation your menopause ne a warm seminar and also sebia ya na yen shada ntimi nya ho hwe papa to say time akora de bibu nensa ehwehwe mu chese sakora bu nensa before age 12 or higher risk of said that obenya breast cancer and so ba so entwa brante which is menopause or trouble after 55 the chances of getting breast cancer are costly.
And teacher say ABI or share a year and 10 before 12. Before now channel late after 55 the chances now. Them putting it to me about
your friend BB estrogen and you might control your menstruation. Menstruation, brayo, right? If it's a call, control hormones, no. See hormones, no. Ni teach you ni mienu way progesterone, estrogen, no. And no, acquires a fuel for breast cancer. Inti or started Brian Termina because we're exposed to the estrogen and terminantino, the chances of breast cancer na ekosro. And Obana so why what one brand terminal. Honest why exposed to these hormones for so long in her life than the normal average person. Into no so a man risk na kosro. And Oba we step you one water. And also because senyin semba na hormones we na akofem it's a lower the risk and so ne dia na ama they are always exposed to these hormones and no ne predispose more higher chances of getting the condition and now ba sebio or she awo ase no abro or we 50-30 eko ni senti still hormones ya
na say ke dia masasa ni nyina.
It's over shy. Yabaka sanka adumpo in a crying. Intina ma say, I say numbers no still compared to the Western world, no Africa your numbers no of them. Cause me can't make sure near mama bubosu ya nanke. I say we are all at risk. I say yama yininda ho.
This is scary. This is very scary because sometimes a sometimes sorry, what's your master so preach? I'm not gonna say teach you be answer when you ukno and you find a me kuno meet here, no so for a can. But they need to say yes, we be a whole movie. Now from this one that you're really mentioning, it looks like for as long as we or no dear, you don't have to say oh me analysis na me hu efimu ye nyinara ye wo equal chance say ye bet to me enya breast cancer. But I'm so excited say ye ubetumi enti actually said there are a lot of things we can do for early detection to say senior na mama Nancy can earlier no oba ye baba back na waka other factors na ibetumi a control ne ho enti mama ho embra na mama Felicia me patro nya me share obi unse obaye mama nti catch me ben na wo hu abnormal growth in your breast.
2022 that was around August na ya there every month me travel.
How many years
me was 57.
Okay.
I started at 25.
Okay.
I did 25 na me won first born. Me 30 baby ho na ma worry me nya me nsa na ma me. Until me do 50 ho na me do 50 kra be 48 ho na me travel. Until say emre dry na the right boy say oba osa wo check wo breast na de no na ya de no de meta me enti ade no SKSP me by 3 months bi enti da ko me wo bathroom sa na bi ka chere me say wo check wo breast a check
but now what I regularly until just a space of 3 months.
Yes. Enti ehwa na no de me de mensa ba akofa ha the normal practice na me de mensa wo de mensa we wo de befa all around we are wa be hwe ha no enti me ye no na me ye the other one na me be hu say mensa ni fa ha me ye ha no asia ton me hu say there's a very hard. It is a buba bi chassis.
Oh.
Enti me ya mo hye me kakra
Because previously na bibisa eni ho.
Bibisa ho. Me ya mo hye me kakra. That was August 2022. Enti na ekoba October na eba. Me ya busy person. Na me say marketing officer of Polytank.
Oh, okay.
Enti edwuma na de enra say ya fa so a. Ukotra officer na party say nimre wafo. Nti me schedule me ho na me colleague office. Nti omo be best screening no. Omo be screening wo ya sorry. Fanko Church of Pentecost Central. No peace and love for number. Nti sana yes see aye body ru aye screening. nti wo kwa na ye hwewa na ye se bibie ne ho na me koda ho na mo ye ya ayewi ya se wa mam bibi se bibie ne ho menko na me hwe nurse nanim na me se wo se bibie ne ho bibi se me no fias feeling some heart inside nti di obeya ne se obema me prescription na me kwetwa mammogram nti me tu anamo kwetwa mammogram me twa mammogram no mammogram no any 30 so there's something there nti the next step it was say biopsy biopsy mama
even though still na omunyi hu still omu feel say bibie ni ho
me kwa me call no before the mammogram no on the omu feel but after the mammogram no omu hu say bibi no mo se me koye biopsy no ana no de omu examine enti ano the doctor no obe examine all right so ntumi nkyerɛ say sadi enti the only thing they say they will let you go and do biopsy enti ano de me koda ho pan ne tintin bi ya de fa I was so mu yi sample
omu yi sa honam
ne bi go deeper ade ne so hye no fo na ase pa de enti ayi na mka che doctor ne say me ene e2 na ekoye ba ko ba so wo sign ya but me dia me ko da ho na ye wie no ade ne me ya be say me ho say akọ me honam enti me ka che doctor na asre enti I was here they call pathology. The one they call pathology. No almost cancerous, aggressive. More times na the P. And see, I'm a Makuma 2 year.
Makuma be 2.
Akuma 2 year. Let me say, why me? Why me? We say, me who dear me, yeah, a coffee, sadly, a buy. And see, me to an amount. Yes, a medical treatment no, but I want no na doctor no on time macra, but all doctors were but the oil penny pan. Because I have limited time, and so I can present me book cry. I have a special care answer. And see, I wanna be my nice. I dream them. Menina, at the assembly. And I met Nami Adum. We took out to baby. Until I said, me could join other assembly. Oh, Nama Nancy or when I may anyway. See me friend upon or say, me chat, may you know, pathology report.
Never send them.
No, me traman. To me traman, no, dear, or say, a while or the tray, Dr. Okolibu. Then the foreign day was a member. Let me two animal. If you say, me and so me sign the coachre me and personal doctor. No, I say fast. Don't waste time. So I didn't waste time. About I no makumetu. If you say, me who be that, me who be when you have breast cancer, the new phone apaya will. Na ya me shishi. Na school kakra. Yankon actually, so I tell him, until I was say, and they said, me did agro. And see, me too man, I'm on a McCoy. McCoy, and so now me adum. I don't know, or my man, doctor. No, dear, you book him for chemo. Now, when you cancer, no dear, chemo, no dear, Ube to me, a baby, or be more, almost yet, and son on my operation. And I say, oh, your operation, we are no chemo. I made a McCoy, no, and now I'm a nice soon see me a chemo. And you may for chemo every 3 weeks. Magic chemo back for 8 times.
Oh, so you had Nemokan 8 sessions?
8 sessions. The first 4 and the second, I think the second 4. And see,
every 3 weeks.
Every 3 weeks. Every 3 weeks. I do we first week ni we are na am lab we I was say check moja check nyoma pii ye be hu say at least we betumi ato aso ana ebi ye ho edu ba bi a na moja no so ati eduro no mama enough first day me kwaji ekimo me call for you know me ko bubu da how by 2 weeks ansa na wo be kwa kwaji ekimo no so ye be ma wo be start here ye be ma won either your family person if you say nije no enye easy sa nti me na me baba na ko nti ye be refer wa ko nurses bi ho no mo akyerekere mu senia ade no wo gi a ebe ye but because e duro nankasa wa refer ma wo nti ye be pesa wo ni obi be kan ho nti me baba na me na ko na me ka chense tie di ye kan aha if you say 2 weeks na me koda ho ono kra na remind me time omo ka chense ebesi nti yero ho nti ano de ye ma okimo na I to say obekwa koto na I to say drip ye de be fa woni pa won sam na korura wo ho na mdue no mu na afi de omo wi a omo asen ama enduro say duro no eno a na obenom by 2 weeks ansana wakoye lab na wasen aba nti eguso anemia obi wi okra ukwaje we na kimo na unkuta aduane a enye wo say wote ho oje so na wudidi biso ho a oje ye the raw part the second part second first one second one de ano de ye to so ana wada oda na ni na nyame ya adum na me fe mu
Utumi G8
ni na nti e ka last but one final one I was so ko doctors no e wo mu na wo hu mfa wo a eno utumi ko hu doctors no eno je yen so kwan but I ka last but one na obekọ eko hu doctors no e ho na e de obema anesthesis na we no so yakọ hwehwem mu se ukukọ surgery nti bibi wo ho e touch ma wo mu a wo se almost hwe na almost tia nti eno so yakọ nti the last one me call ya no me ko hu doctor no ka chere me say o meye me na asem kasa na referee 8 chemo na couldn't even turn the
like destroyed the cells,
yes,
the abnormal
it
cells.
was there like that. Very hard. It didn't move. Some people will say that mine have moved. I shrink it. I say, me dear, send me a team one. Sa me feel a santi. Me da was an the myself can say. But say me Jimmy uncle for dinner.
Na me no kwafu.
Na me no kwafu. Enti me ko analysis na wie esabe hu doctor na obuku me. Enti that was last year 1st June na ebuku me for surgery. Amede omo ka say na before biopsy number no na me was stage 2. Nti omo ka say ombeyi lamp no efi ho na omo nta.
Within that short period, like 3 months per way, one share now, so stage 2.
Stage 2.
Don't worry, Mama Nancy betcha here stages now.
Enti Emma me operation here me ye lamp no. Ko ye lamp no ba fie. Na nya easy. I was asking myself, me ye ni na ya na so me ye lamp no ye. Na my dry pee. If you say, I was see you na. If say, I was say, oh, it's in the last night after we know. That time we have a appointment. The appointment is no nurse, so it doesn't matter. Ni na etumi ye adwuma. Nti me ka makoma to yam. Fidie enufo na ma akoye na me nim say we no mom aye half no. Be kase ye chen we no. Aso ye gusu treatments.
And this is after how many weeks are ye surgery no?
A year surgery no. First month no. A year surgery no. First month na no de wa enso baba begina. Nche ye lamp ye ha. Ye be yi wo lamp we see a there bibi eno so bi wa ha.
Mo fe no mo say is badwa na badwa. E kan say
adwa.
Okay.
Nti ye yi ha. Na ye yi ha. Na ye de tube ahye ha. Na ye de tube ahye ha. Nti won fiti atamra no. Na tube no ahye ho. Na rubber san ho a atwi nsuo na ewo mo no. Nti from that na on betwe saa nti ye be discharge wa ya hwe na nsuo na ba enough a omo be discharge wa na omo eyi rubber na fi ho. From that you go for dressing every 3 days. You go for dressing. Nti you go dressing na say omo be check wan kasa krampo wo ho no nsuo ne bi begina omo a ebegina wanufu no mu a anase omokro mo atwa no nsuo no so kra bi begina omu a ohu ye obasa ase ha nti o Philippa o kwa 3 days na wo sa wo na wa panye ye de awanufu emu chinsuo omo wi a omo keli omo hwenso dodo a na omo de ya omo we.
Mama, any what call a very painful experience, mo.
As Christus.
Nyame na yedana sema wonkwa.
Enti me fa na ina mu me kuro no afedu ba bi no a me call ya nso bi amba. But no mo say honam abeka afi na growth na eba. Te yi ase ha. Enti afi na nkakra ehọ no be form ebe hele aha nti ebe ma skin de nyame de oye ne bibia wonti ase aha nti sa skin na ebe ma nufo no ye kese no we no ye kese chen we no eno a be form sisi ayepe ansa na ebe you fi surgical ho no akofi no ye be yi we yi ne pe we sa de akọ pathology. Ehon na ya ko hwehwem hu the type biopsy first one dey omo ekire but the second one no
of
na ekire exact level and the kind of cancer wenya omo koye nti abasa ye be ma olete na ya refer wa ko analogy asede radiation department surgical for you omo dey wi they refer you. Until we feel hospital hono. Now we register.
Radiotherapy. Wait, into mama and sana ubeto aso radiotherapy no. Now we can be about na ye can about near factors being so ebema with me as those controllable ones no. Aha na ye can no ye perceive say bia na ye compare like mama ye can on tears then no yeah what did she do wrong? What are some of those factors from your professional point of view no?
That's it.
Mama we dear that was any experiences I want to share. Seriously it is I couldn't just imagine it because so fasa or yawo any abebresemu within that period 3 months enya dia ebia one time enye but just a space of 3 months then in your fame no utirim kwabio
That's
there say you be san ba ne atwa so e wo radiotherapy ho no. Yes mama.
Intine ka non-modifiable risk factors. Yehwe mama die a owontem. Ena
It is a won't tell no crand a better
brasso grantem.
Intended to cry a better man.
Ena oyoba. Inti I can say that no way no fool can see it. Inti I can say with her or family history?
No.
Into the fact that
Into busuani mo kwa bi eni wa wonya.
Benko a.
Ukra bi mpoda.
Into some risk factors ne de. Ye ka say nipa bebre nya ya rains no muni. Their only risk factor is the fact that they are women.
They
Your fan on a non-modifiable one na, is that they are women. Into the risk factors that we can really change. Ni fatty tune a diet. But about the diet,
diet now I become 70.
Into the can diet.
Yes,
yes, food that is rich in fruits and vegetables is protective. It reduces, yes, it reduces your chance of getting breast cancer. So be an idiot, ne daddy, no, or ta or atoso pano ono sana ne chances so de benya breast cancer no ofem ena ne ono no ne duane die no atosudie nhyeda ni musa ono no ne chances no wosho and that is about food. About honor there are so many things and so many questions that can come out of that. Yes, but let's jump into where you risk factors cause the modifiable one yetimisesano cause breast cancer no yes a fatty tuna kokojini aduane ayedi book bi am kind no say 30% aduane no contributes 30% of all the risk factors, and that is the highest. Nyaka no sanom obi onum sadending eso no sadending we increase your chances no of getting the breast cancer.
Even among young generation.
So you see, we are predisposing ourselves all the more. The fact that you are a woman is already enough to enough risk. The other ones never come one. Not just say nyamiam bemwa na ya jinsem. And I say smoking into both the primary and secondary no. It increases your chances of getting the cancer. Smoking, so once even if you smoke just a stick of cigarettes, you've increased your chances of any form of cancer, not just breast cancer, any form of cancer. Smoking is part, alcohol intake is part, our diet is part, sedentary lifestyle. Since you'll be up so you do our office, over office 8 a.m. Now upon 5 p.m. So see when you wash your hands or call lunch, and now we'll call a washroom. Yeah, to compare tetena, minimum foam, the walk miles every morning, every in and out. Our time is not like that. It makes me like I said, it's one of the contributing factors because your lifestyle now is even on so see shop obi to ade osori no yimana asansat now into nanti en sheda ni abrabo musa this is nyame adom bebi onam bia obenya ka bebi obenya bia anabo say okada kra na say asem no first ni danka udu junction anka aje wonanteko this okada gina junction ho twa udu ho hwe wa bre na wetue wafo na ho call. These lifestyles gives us higher chances. In non exercising shadani ya brabo no. And also my chances ekoso. And our stress. Stress na die men kan ho asem. Stress na die say yes when it's no die. But let's find time to breathe. Let's find time to rest. Sanomeka. Let's find time to rest.
Inti odofo say e bia afi na wabeka ye ho na nene ye hwe breast cancer na ye me wo ma me ba ko ha enemy nua ba na me ma me no ni din ede mama Felicia Amono anya me ye na dom onya breast cancer na nyame ne dini efe mu ene o wo ha say or share ni personal experience ne be ya ono nya wo hwe nanim po a ode kasa na obehu say eyade a onyanka even the worst enemy shouldn't get any condition and go through that ordeal. And mama oka ho oye palliative nurse specialist wo Kolebu Teaching Hospital, the surgical department, Mama Tabita, Nyami Eshira will be bure. What's it? Muye Juma, Winnie Obanansi, Muye Juma Papa, or surgical unit Honomo, na or no, and so Enna and Ne Yenewaha Nancy is Shen, and na ye chichi and Komoe. And to say, Afen Rabeka, ye Sheni a breast cancer eba. Watreche yemu no mana wan kasa obetumi akontrol etumi edeba eni ni a wuntumi enye hwehwe wakase ni wuntumi enye hwehwe no so yoba wuntumi enye hwehwe ni ye wu buhwe wu film asen genetic relationships wuntumi enye hwehwe so wonufo wuntumi enye hwehwe emra wode hye we fitri kwase eni emra wu twabra all these factors wuntumi enye hwehwe emra woni nsen ye se wuntumi enye nsen wuntumi enye hwehwe bania ye betumi aye ho bibi no enoka say about your lifestyle sisi all kanya na medwe ho last time me ye exercise na medwe ho dem say ye nyina me ka say ye mbisa ye ho a ye benya a lot of reasons into yentumi enye skipping yentumi enye jogging yentumi enka yenko some prayer walk bi ho na nka woni wukuno woni oyere odi anwumre na wie na anwumre Saturday yi say na mo de bomb paye na bro na so asa mo bon ko mo kita mo nsa na mo ko na ye de ye exercise nkakra ye benya dual benefit both the spiritual and the physical as well enti mama we de ya homte diet na o ka say 30% etimi contribute no kra na yes scary no enti say ye ko ni say ansa na beba ye beye ne de no na mama bo about stages be mpese o de efasa stages ni mo na ye fi ho a ya hwe na ebitimi aye afi ni ebi telephone lines no ama ye ahwefo no
me da se bebre nti breast cancer no started was stage 5 stages. And your friend back stage 0. Until from stage 0 to stage 1, me da say no na ye trauma yen. Until stage 0, stage 1, stage 2, stage 3, stage 4. It's up to stage 4 no. Until stage 0 no. And on a day, anka me ya anka investigations ni yedi hu. Oko amono nene enkura omo akwanim wo apomuden nsem a omo wo routine screening every year compulsory routine screening until it is at that stage that you can pick out the stage 0s into stage 0 no ma physical lampemba mbede mu na wakase mehu say wo menufu nim until no it's picked by the mammogram or the breast ultrasound or and no ma yedi hu tenoni stage 0 ehwehwemu chere stage 0 down 5 years survival rate 100%. Yes,
take it a bit.
We say 5 years survival rate 100%. All of them so by the grace of God.
Stage 0 now.
Yes, so all of them will be alive. Yes, okay. Yes. Into over stage 1 now. Stage 1 no ababadim. But abano less than 2 centimeters. To say offer one peswa coin binani ye used to be no. CCA de oko your market in use ba oko malls they are able to the peswa coin 1 peswa no. So stage 1 no is like that. It's very small. Into visa na da wenu from na se nyame adom wenu fu bebre se me die ya. Nyame amboa na onya experience that you can't pick that one out. Into na se ba the other na ye be boso. Then we come to the stage 2. Into stage 2 na bana be between say ye emfato ho a between 10 peswa coin to 20 peswa coin. Or say your coins no 10 pesos any 20 pesos no. Into stage 2 between the 2 cm and 5 centimeters or hona ye stage 2 in a hono yare na aka yamato as edua ewo aha into stage 2 no ubenya edua kakra ewa motiom ho na yes enya yare na akọhọ ni bi
Inti, are we saying say a bi wo ho a by all means ube ho aba no wo no phone mo and I'll be saying ho love this and as a live no when they say can we try me bad rose inti and no ashimiti mo say
okay akam kasa na ahoro obi an send your friend minim lymph node into edwa
okay inti the same thing me that say
inti yabano stage yahwe stage 2
patron stage 2 so na what
ti call stage 3 ya stage 3 is any lump size bigger than 5 centimeters inti stage 3 no me come say be 1 cd coin echo ti won send 1 cd coin the size netien edeko nti ebi de kese a kopem se be fe nufu ni nyina tenani stage 3 na no so edwa affect edwa more than 10 bi ewa motwem ho but still ni nyina ejina nufu ni enko bia foforo eba ni stage 4 na stage 4 ni friend metastatic disease no eno ne de na sebio yawe na atra nufu no atra edwa ho no tisia akọ either ahrawa anase mrebo anase adwenenim anase dompeni nti edro ni bi cells ni bi ekọ mojanim nti senya moja ne edi efusa nti bebi obekọ akọ settle office aha de asenya wo hwehwe rent o dan aso na wo pedan foforo won say o scout take akra aha ti bebi obekọ konye office aha de beboa me no na watena ho no wa start dore ho na wa say ho organ ne so obi timinya just one side obi so timinya multiple organ metastasis obi timinya ni brain and the lung obi timinya lung and liver but ashas na ya na ayebako na start
advance
into bedru ho no in fact say udru stage 3 enye hospital bia na say bebia na bia stage 3 lump or shena say be after treatment na say why you responded to chemo ni ade na abo no fine obetimi aye but stage 4 lumps there stage 4 ne there surgery is not an option because area no oyi enufo no krana spread area then no sana just say you are limited to the other line of treatment the other line of treatment which includes palliative care nyamia dom the breast oncologists they involve the palliative team very early once they diagnose say nipa na spread na they involve us into the journey for some time about 2.5 years depending on the stage of the hospital a big majority of patients no I say they report from stage 3 going majority into no sana say yeah survivorship no confirm because stage 3 dear survivorship no jinabe 60 to 67% is around the 60s. I'm not sure of the figure real, but it's around the 60s. In stage 4 dear
it's not just offer a mabe say edu
offer a madua a move 4 a be
ombehwe omonkwa na adentina ya mantem no what do you think from research from your experience dentina because unlike mama de ohu ya odi emeka nyame adom so wo ye na dom bebre nyame sha but what do you think could be the reason why we don't go early last time na cervical cancer for cancer bi wo ha well oferi say bia bia cervix ne she bi beka say na
akobo adwaman
ni adenti no oferi na mo de no so adentina so
with a little interviews kakranka omo mantem ye biso omo no eya na bebre na so si ye betwo mu anufu no bebre na one the myth that unya cancer it means you are dying eno ne hye nipa na adwenem ti menya enufo yare enufo kokram ti na chese mi bewu Inti sade o ma hospital kra. Inti eno no so ye. So the fear of
sa issue of fear me pese yebe hwemobio. So the issue of fear, the issue of even stigma, those things. So fear of the unknown and the stigma and patcho. Mama fire telephone lines no entudwa na yasa a discuss we because it be ama mashri obi a great love one be pen. It's way there you say ye can we ni nyinara no na obi biara enam breast cancer nti washre wodofo bi anase wo bushani bi no ye mpabo ne se onyankopon ebehye obi biara ede ne akosora yakon sa entokwa together. Into telephone lines near 025 625 3461 025 625 3461 and I say 053 83 50625 053 8350 and chair ye call quick commercial break ye ba na eno de ubetumi afre na afe ye be discuss the issue on fear and the stigma associated the myths and misconceptions about breast cancer. Nyame ehwamo bebre.
Don't call me. Ghana for Methodist Asafoma. WTV Enyamfienu 5 years. Hooray! Na enam emfienu mafidida. WTV ADNT. Or yet don't call me promo. And it says, Sawaya Ghana ni now our business. And Juma Kubia Opeso Bomu Deura. WTV say, Ye babe chat with Juma Kuno and as we got on Diano. Ya Bomu Deura na what you 2 weeks at the amount. 1,000 Ghana cedis per Aubetia. Way a Yakwanya WTV Airfaso at the Adawasi say. What time the chi? I'm a doom pempenswa and never do. Some promo here didn't was make a cry and I Yanunti, Muamu Makua Mopesa Mubohu Deuruno. Muntu Tumrika, Namomrai, Fred WTV, Nani Penfoning Como, Emfa don't call me promo 0593 110733 and now WhatsApp 0256 253461. WTV, reaching out to the world.
Nyansa ashese onyinyamishu. Let the little children come to me and do not hinder them. Matthew chapter 19 verse 14. Oh yes, let the little children join hands with WTV every Sunday for a special children's service with the Methodist Church Ghana at 10 a.m. with a repeat at 2 p.m. on WTV and Facebook. Nyasa ashese onyinyamishu. Wesleyan Television, reaching out to the world.
Yadamasi bebre same with me enya botre atwen ye na yede telephone lines no atudwa enti so pesa ofre o pesa send a WhatsApp o pesa share personal experiences. I think this is the time you could do that. I have here 𝗟𝗜 khi and then Mama Felicia amono ewo hase ne mo pese mo bise bia betumi ebisa na ye twen mo no na ye go back to mama mpacho na mesa about so Mama Nancy ne aka about the issue of fear and the stigma, any misconceptions and as a myth around the breast cancer. Mama Nami bisasa woko radiotherapy honomono ye den ene demawo. Hello Mama Felicia. Not me bisasa woko radiotherapy no then ye demawo because no why surgery that why chemo it was surgical and now my surgery now and Jamiadum almost say Pacho Maminko Kumasi Embracesia. Hello, Oba Messi. Good evening, Obapa. Pacho said Jamiadum Mohoye.
Pacho nyame adumo na so.
Adoma ne kura yen ha. Pacho yetio.
Okay, conversation na me tie but as me so me nufu ye me yakakra nti no me the call hospital, that was Peace and Love Hospital. Me call ye 3 days. Ana mama me a draw, but as still me take a draw still me nufu no da ho eye me ye na jo na pains na ye more. But a draw and a pani e wiade an so anti pains ne papa. Nti me so me de no so me ye ne den.
Pacho, oba pacho we di mfia he.
Pacho go 29 years.
29. And it's not associated to your period.
Pacho the day class. See a period na carry. See I me no kasi asa me nti period na dey. But just this month ya.
Me pacho you. Enti mama on be ma as anu ye. Me da se bebre. Hello Mama Monique. Hello Aba Monica.
Hello.
Yes Mama, pacho what to say?
Pacho, Monica, I'm
pacho you, ma yeti you.
Pacho, I just wanted to share an idea.
Please do. Thank you.
My auntie has turned into those breast cancer. But then,
hello, Monique. Hello, Monica. Please, can you reduce the volume of your television?
Okay,
thank you.
Okay now.
Better, great. Thank you.
Yes. You know, my auntie had this breast lump, and then when she went to the hospital, a doctor told her that when she goes to, she's going to die because the breast will be cut off. That is what the doctor told my auntie.
That she was going to die.
Come again?
That she was going to die because the breast has...
Yes.
I'm sorry about this one.
So I told her that she shouldn't listen to the doctor. She should rather go, whatever lump is to be taken off and she'll survive. But then because of the fear in the air, she got scared and refused to go to the hospital and stayed home doing spiritual all those stuff until the thing was to take that and I destroyed and her body. So I think that most often when it's October like this, they should educate center. It's not only the spiritual welfare that is going to help you do activities breast cancer or whatnot. But then when you go to the hospital, you receive treatment and do the spiritual aspect also, everything is going to work out for you very well. So I think the education should be more when it comes to breast cancer and then the church or the herbal medicine. And then some doctors, the way they talk to their patients when they come, I think it should be looked at. Yes, thank you very much.
My dear, thank you so much for sharing this experience with us. Michelle. Hello, Abba. My dear, good evening. Kaswa for what to say. Pacho yet you.
Amen.
Oba Pacho, ube to me ejina ye kakwa ni ya tewu ni ye.
Basically, no one else
okay, okay. Mom Pacho, it's there in ya fraban. Aha, in a way then.
Until not now, then
okay.
But my years from 3 with you, but I'm only about as about them.
Okay. Me pacho you. Na o Accra ha say. Kaswa. Okay, into bit me about surgical no my or breast screening, right? Okay. Mpacho you. Okay. Hello, Mama Florence. Hello, Mama Florence. Right. Thank you. Mepacho, I think we can start talking about the first person and then a few others that they have spoken.
Yes. The one that I remember.
Yes, and son I'll be first one. I think I will be glad that Mama be handle just a quick emphasis on the second caller no about the role of the church and then attitude towards Pacho Maminkofa Uncle Sam Kumase Embra. Hello. Hello.
Hello.
Yes, Papa. Me Pacho.
Good
evening. Yeah, that's a afraid you too.
Me Pacho, na me person visa doctor fair. Age ben na obi who say when na obi timi enya bi. Started from
age ben. Okay, Pacho you. Obese sisu bi mama ye. Me da say. Yeah, the possible ages are obi to me breast cancer. Thank you. Right, Mama Pacho.
Yo, yes, second caller no ka say ye mo hu dawuro. No mo say
na oka about the fact say a sign if a doctor ne catcher ne so be wunti any onko hospital no kora and they say empire enko na obo. Hello Pacho mama ko pam member wa. Hello Mama Mary. Yes Mama.
Pacho, Mr. Bigger, you try.
Okay.
Hello.
Yes Mama.
Mr. Bigger, you try.
Wow.
But they try the beginning to move 9 years a bit.
Wow.
So much more come to you. What the fish but no say no more can. Muslim down and some can worry. But the baby say
Oh, I can't say back on I there. Mama say back on I say I there.
No can be.
It's me every no. Pacho.
Okay.
Pacho, yeah, that's with the congratulations. Yeah, Danya say ma okra 9 years.
9 years.
Pacho, mami fa Mr. Edwin and so Embra. Hello, Uncle Edwin.
Hello, good evening, madam.
Good evening. Nyamisha, do we for home to say?
I'm not aware.
Yeah, there are that's important you too.
But your person is a rich factor, no? Breastfeeding can one.
Me pocho you also breastfeeding waka na pocho ye that's mama be ma ho answer. Thank you. Mpacho enti ye ma ye responses no na fi ya chado.
Ye ma me na o ka say ne ma me nya bi na ehun ti doctor no ka kire ne say ye twa obewu ne nti boy ntumi ntu anamo no a yes ano ampa ewo ho me say me die bai obi ka kire me say onim ha bai bi me ko hwa no pasho beko but my dream anko
mo antino so be ko he ba
ebi say me ya wo me ntiti mu no wo yare na wanko hospital me papa baby say ada na wanko hospital until the first way say me ko hospital until me omo kwane na mo sa na eno no mbeba na aye late
delay sad
last minute wo beba na wanu phone aye nsamai na ye nsama na wo de basadika ho no
bibi eni home
betimi de aye na ono no nsini na heba no so wo entro no wetumi aye obi de na ode abeto we so ama nipa no a kire se wanya nkwana obetumi akoda ho a don sama ya na wo wetiko se kokolebu eno no bewu breast cancer anodro eni sofo bi ho eni bibi duro mu obi mu se omo no bibi duro na ebra na ase eso ade no wo ho nti adan abrochire kura sesi a obi mu anu fusoso a they go freely na yi abane bi fim wahu na bibi fo na ya adwen se ye kwani ye twa ye no fu ho a ebe edu ba bi no na mo se on betwa I don't have any problem.
Send no na be ma wo
kwade. I don't have a problem. If you say we have facility we are this we shakura who say you try no fu. Wahu. Enti me stress omo dan wa de ehu eni omo ji se eduro wo ho bibidru wo ho oh me dey
obi wakoda prayer camp
and na so wakoda prayer camp yes doctor prayer camp bi ni cramp wo pande wo mo pande oh last minute e be don sama na ye wo achi kokolebu a wunya nkwaje bia oh enti wo hu abra ye twa wo betena ase wo ma ya ofre o se 9 years
9 years sure
oh dan ya ye twa ne de ana ye yi we ne de wo beti numbness na ade oh
enti no ansa mama de na o ka se o feeling numbness in the other breast
enti no sisi an okoye baby okoye wo no kolebu wo ho me metumi aka se so metumi
enti na onsa enko back na ye hwe no
ye be hwe no kolebu ho de me du kolebu no mi hu se ehwo ne ye kona abotirim
okay why ya dear enti na mama ye sisi wa ansa asori dear no dinsi for dear no any the issue of numbness no for the other color no me pacho na ne obisa also about age any age obetumi nya things that we mentioned but at least because of menti obetumi abosubio na obi nso obisa say nufu is it breastfeeding the role of breastfeeding yeah.
And that's very into age, you know.
And no now with the breast size and so I can hold am I empirical. What's the role of the size of the breast? Does it really matter?
Oh, okay. Into say share which one was I saying? Was it the breast size or
we're looking at the age, we are looking at the breastfeeding and
so
looking at the breast
age,
size.
You know. Okay, so with the age, you know, other places we will say postmenopause, but in Ghana, premenopause.
So now we're coming between 25 to...
We've had some patients from 25. The bulk were from 30-something to the 50s, but we've had some 20s and so below 25, a few. Yes, there are also a few. So the only thing is that you or be observant. If you check your breast every month now, regardless of age, age be particularly say some report very young in age. Others to symptoms in a later stage, later when you postmenopause. But majority of your patients before menopause patients. Okay. The fact that you're a woman. Right. And in fact, a man cry.
A man, because so can some more 1% chance.
Men also get it.
Right. It's in a camp, but to say there, do we have the issue of plus breasts, the issue of breastfeeding with breast cancer?
So with the big boobs, okay. Someone will say, oh, big boobs with myth. So we know for sure, no yari, Mr. The only thing is say, if you don't have big breasts and you are doing self-examination, because so if there's something in it, you can pick it early. And say nyamia dumu bebrea, very dense. And no, self-examination, quite trickish kakranti. Sabani woman stage 1, stage 2, you might miss it. Except say be exactly. That is the only difference. Okay. But the fact
otherwise, I was going to ask say be or more cosmetic surgery. Say DBA can or more DNA if it has any challenge or something to be worried about.
I've not heard any. I've not really researched into it or read into it whether it has it predisposes them, it gives them a higher chance or not. But all I can say is
the fact say I think the word can say if it's a swan, the inability to pick and picking it
easily, unless say an experienced person is doing it for you. And no crown say mama dear crown and dear crying so. And so the nurse nearly missed it. In fact, the nurse missed it.
If not for the fact that she had identified it.
Yes. So assuming she's not the type who has been doing it and has noticed it. And call
very late.
Within 1 year. Because I know last year and I check here.
Mommy is be back or embra. Your banner account about
breastfeeding.
Pacho. Hello. Hello, Mama Janet.
Hello.
Yes, Mama. Me Pacho, my head of what to say. Hello, Mama Janet.
Yes.
Man Pacho yet you.
Hello.
Pacho yet you.
Because we never the about
it's been a day.
But we do about
Pacho you, Mama. Me dasi be brain, Yamisha. Me pacho me cut doing. Hello, Mafia. Hello, Mommy.
No questions.
Hello, Mafia. Hello, Mafia. All right, Inti, not yen share about breastfeeding or.
Hello. 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 Hello.
Hello, Mama. My TV no come from Papa. Mama, lower television.
It is almost seen now. Almost hospital.
That's why that's it. Okay, ain't not making about the issue of Pacho stress say I'm a friend no mama mo television no sound no ako from amayempa why need me at near more can so breastfeeding say your breastfeeding enquire say your husbands and so any say or yuri or ne yuri nufo e diagram say off what's the relationship any benefit and I say it doesn't have any impact.
Thank you so much. Pacho Aduful breastfeeding dear so ma kra nufo amenufu nsuo na ba no eno na protective in the sense enufu nsuo production hormone ba ko friend prolactin and do so edimu accompanying ehenti during sa hormone no was raw ma we estrogen level no wo fem me just estrogen projection so eno so na efidi enufu breast cancer ni enti say oh more prolactin by the time a woman cry no phone born ban till say obey den obetwa enu obe stop say enufu nsuo no begya ya ma biem enti no ene ye protective say okunu ni oyiridi empemu agro no de nensa anana no enam oba na enufu no de eno no ma enufu nsuo ma enti onya that protection no but ade ba ko no say because nensa eka ho ninti no so the nensane etimi yet as an your examination ama wo no eno no sa baby dem no be picking it in the sense that wo no oh ye no once a month or I will check out there once a month but I know they say in so once a month obiba every day obiba week obiba 3 days it's every 3 days you are being examined it's eno no ye nensa no pachayati ase but enufu nsuo na ngasa die akra na twe enufu nsuo na eno ba ebo oba na ho ban
Inti with the aka yemre kitubi na yako just in 2 minutes can you help us with ne appreciate the various sign ye will be who say it was a call and na afi so between the breast I think Mama Sha say kakra how to do the self breast examination near the aka ho.
That's a few
minutes.
Inti enufu ni mienu no sebio sizes na enyepe. Bako so chen bako kitwe bi but once I feel they say bakwa e kosroko bo pan chen bako and bakwa e Ghana is longer than Africa chen bako na chese asem e wo ho nti the size of the breast of the two breasts can detect say the air koso se no fu ne ho no rashes beat me go ho e kro ti me to ho me patient video so as a pimple o team na ye kro you hu is afi de aye kese no koto ya no nkunkun ya bi office ye kro keke no de so enti onu de osi wanya ne ya enti after about after about a year or some months omom de me aggressive na a few months na afi de pain has started Aduful breast cancer sha se enya ya inti nipa na hwani o de betena ho a inti time a pain be ba no we do palliative stage oya on start pe na chese asem yaba inti ekro beto enufo no ho rashes beto enufo no baby o ebetom skin ne tom te say obi a wo dimple na fono osre a onya dimple no se skin ne tom sana eno so ye sign ya ba enufo na no a se wenufo na no estati say etwekom retracted nipple and also is one cardinal sign.
Actually, say proud to that na nipple ni si ho.
Nipple no ebi di ejina ho. Ebi so dey flat. Inti say flat na start twikom a asem yaba. Ejina ho na start twikom a asem yaba. Ye maame ba ko no say bi na school sem ni mu ka sa. Inti wo hu say bibia beda na nufo nim na ko hospital no. Also ko no nipo ye scan na say menopause hormones inti ebeko eno no so nim say enufo yawe de kuru inti ote ho na ne de ne twikom onim say ono ne menopause inti time I started say obowa na ko hospital asema bowa che yekoye nhwehwemu no na yawe na akona hra wa mansuo bi gina ho inti Aduful no enufo no eni say size ni different eni say ano no etwikom etwikom asem aba skin no ho se ho te mi yes se ekutuo edwan yon se yeka ne se ekutuo akese on se ase ntokro deda down those are signs of the late stages enough no ho yes na chese wo ya ben stage 4 na chese aye wo stage 3 ankasa chese enough no akwenim yare na akwenim inti eno so ye another cardinal sign inti ansa na abano so de ya che mo sizes no
why ya de wa che ya abano sizes no enti mama o last word ansa na yakọ na oba so o last word de bi so ana just in 2 seconds and mama was 2 seconds last word
me ka chiro bi ase se wo hu bibi wa wo ho a entena ase se wo ye oba nko ade sana e ma me chechire mu otuminya enti to one more early detection save life men to sana mo na nkase se be
early detection save life
and na me dey two me trim
aya dey
na me dey two
yeah that's it Javisha oba also just a second we have just
menasi bebre
aya dey mama
enufo mu kokram etimi to ase ni nyina ne se wa obeye nhwehwemu nhwehwemu ne ye wa wonsei bosumi bia wabu nse wie no ye obi a ogusu ye bra wabu nse wie no 5 to 7 days after your menses no na wa wagina wa hwehwe nanim hwese ne wanufu ne mienu ne sizes ne tie hwese ne a nipple no shape ne tie twikom ana gina ho ekro bi abeda ho rashes bi aba ho o hwese anema yi wa hwehwemu a
we dey o hwese adrove wo ahwehwemu a eno be ma wadwen akoso mentwen na wonhu ne mama nansi kana ma ya de bebre se metumi ene ye wo se chese edoso ama ye ntumi ewie empo ba ye besan ababim na no de bi telephone lines na enter no metumi ebisa mo ensem bebia obi a onyankopon ehwa mo bebre Phoebe Dazi echna nyame ya adoma eye birthday wo youth young people service our Better Society new Aplaku circuit nyami insha any Aplaku for nyara nyami insha mo nyami adoma echna ibeshia wo asori any baby obi biara will be the crew. Thank you so much for all the support and the love and mama